So, Dr. Jada, in your office, what is your concept for using GLP-1s? What's your gestalt? The way we describe it in our office is this is one leg of a three-legged stool. A stool has to have at least three legs to be stable. So when we pull this leg away, what are your other three legs going to be? You have to make some changes while you're on the medication. We don't intend for you to be on it forever. How do you handle your patients in Atlanta? Well, you have patients because God bless telehealth. They can be anywhere.
Right, and I'm so grateful for that too. Yeah, God bless telehealth, and I have pictures all over, and I will tell you the important things. I'll go through a list of things, but the three things that I think are most important is knowing that you're the best candidate for it. Second of all is being mindful of, as you mentioned, the dosing. And I'll tell you why that matters because you just tapped on it. People who want to do rapid weight loss, so they're constantly kind of chasing. I'm ready for a new dose. I'm ready for a higher dose. I'm ready for a higher dose. And a higher dose is not always really the answer. So sometimes we have to look at why the why you've been responding and now hitting plateaus. So I think the monitoring is really, really important. The eating part of it is super important.
That's right.
And the other things that I don't think people realize, because I too, I don't operate as a person that I want you to be on this for the rest of your life. This is a tool. I give this example all the time. If you are, let's say you're building a swimming pool in your backyard, and at some point you got to have a huge backhoe to kind of dig all of that ground up. You need big equipment. You got to rent it or have somebody come in and bring that in. But once the pool is up and going, you don't need that. You need a skimmer for the pool. You need different things, for the pool because now that tool that you needed in the beginning, you don't necessarily need in the end. And I'll tell you, a lot of those
Gotcha.
maintenance tools people overlook. So it's,
Mhm.
are you getting proper nutrition? Are
Mhm.
you getting enough protein? Are
Mhm.
you getting enough physical activity? A lot of times people aren't doing the right type of activity. When you're on GLP-1s, you got to be mindful of your muscle. You know how we used to count carbs, like really, really count carbs?
Yes.
Now I'm telling
Yes.
people, forget counting carbs. You need to be counting protein, counting grams,
Yes.
because you don't stumble upon
Mhm.
enough protein to be on a GLP. You don't stumble upon enough
Mhm.
protein if you're not on one. So
Mhm.
that means being calculated, being intentional, being mindful. Because if your appetite is is low and you can only eat a certain amount, it shouldn't be an apple.
Mhm. Right.
It
Right.
shouldn't be a handful of
Right.
popcorn.
That's right.